Have you ever walked into your kitchen and stood there, completely blank, wondering what you came in for? Or maybe you forgot the name of someone you've known for years, and it shook you to your core. Now, if that's ever happened to you even just once, I want you to hear this. You are not alone. And more importantly, it doesn't always mean you're getting dementia. As a brain doctor who's been walking this path for over 30 years, I've seen hundreds of older adults struggle with memory, confusion, and foggy thinking. But what shocked me most, and I say this with all my heart, is that many of these cases were preventable, and some were even reversible. In today's episode, I'm going to gently uncover 6 common causes of cognitive decline that are often mistaken for aging or Alzheimer's. Some may be hiding in your medicine cabinet. Others may be the result of a vitamin you're missing, or an infection you didn't even know you had. This isn't about fear. It's about clarity. It's about hope. So, I invite you, as someone who cares deeply about your health, to listen with an open mind and a compassionate heart. And before we begin, let me ask, have you or someone you love ever experienced sudden confusion or memory lapses that just didn't feel right? If yes, comment yes below. If not, comment still good. I'd love to know where you are on this journey. And if this topic touches your heart, please subscribe and turn on the bell so we don't lose each other. Let's begin. Number 1, medication mayhem. Could your pills be clouding your mind? Let me tell you a quick story. A few months ago, I had a patient named Harold, 73 years old, retired truck driver. He came in with his wife, who was worried. She said, "He's not himself anymore. He forgets things. He stares at the TV for hours. He even called me by his sister's name last week." Harold looked at me with tears in his eyes and whispered, "I think I'm losing my mind." I sat down with him, reviewed everything. Turns out, Harold wasn't losing his mind. He was taking 4 different medications that were slowing his brain down, and no one had ever told him. You see, some medications that seem harmless can quietly interfere with your brain's memory center, especially when you take more than one. Painkillers, sleep aids, over-the-counter allergy pills, even medications for bladder issues. Here's a number I'll never forget. According to the American Geriatric Society, more than 1 out of every 3 Americans over 65 is taking at least one medication that may impair their brain function. Now let me ask you this. When was the last time you reviewed your medication list line by line? Do you take diphenhydramine for sleep? That's Benadryl. It's an antihistamine that blocks a chemical called acetylcholine, which your brain desperately needs to form memories. Do you take amitriptyline or oxybutynin? They help with mood or bladder control, but they also reduce blood flow to the brain over time. No one warns you. No one explains the trade-off. But I'm telling you this now because I care. When I took Harold off 2 of those pills and switched one to a safer option, his memory started coming back. Within 2 weeks, his wife said, "He's smiling again. He jokes with me. It's like I got my Harold back." That's why I always say, before you blame aging, blame your pill bottle. Can I ask you to do something simple today? Go get your medications, all of them. Write them down. Bring them to your next doctor's visit. Ask directly, "Does this affect my memory?" You deserve clarity. And your brain deserves to breathe. If you've been taking any sleep aid, a painkiller, or allergy pill for more than 1 week, drop a comment that says, "Checking my meds today." Let's start this habit together, because protecting your brain begins with knowing what might be harming it. Number 2, the night thief. How poor sleep quietly steals your mind. Let me ask you something. When was the last time you had a full night's sleep? The kind where you woke up feeling rested, not groggy, not stiff, not confused. You see, memory loss doesn't always begin with the brain. Sometimes it begins in the bedroom. I've treated hundreds of older adults who told me they were losing their mind, but after digging deeper, I found the real culprit: years of poor sleep, and no one ever warned them. Here's what Harvard Health Publishing says. When you sleep, your brain performs a kind of nightly housekeeping. It clears out metabolic waste, resets emotional circuits, and reactivates memory pathways. But if you don't sleep well, those toxins stay behind. The result, you wake up foggy, irritable, and forgetful. And over time, your risk of cognitive decline goes up quietly but steadily. A study published in JAMA Neurology found that people over 60 who slept less than 6 hours per night were twice as likely to develop memory problems compared to those who slept 7 to 8 hours. Let me tell you about Margaret. She was 68, still sharp as a tack, except she couldn't remember recent conversations. She thought it was Alzheimer's, but I noticed something strange. She was waking up 3 to 4 times every night, checking the clock, and never getting back to deep sleep. Her brain wasn't broken. It was exhausted. I coached her through sleep hygiene. We cut out caffeine after lunch, we reduced late-night screen time, and most importantly, we created a calming wind-down routine. Gentle music, magnesium tea, a warm foot soak. 2 months later, she said, I feel like I have my mind back. So let me ask you, how well have you been sleeping lately? Do you fall asleep easily, but wake up in the dark and can't fall back? Do you watch TV to lull yourself to sleep and wake up even more restless? You're not alone, and you're not broken, but your brain is asking for deeper rest. Drop a comment saying, I want better sleep. Let's create a sleep ritual that protects your memory together. Number 3, depression that looks like memory loss. Let's take a deep breath together, because what I'm about to share might surprise you and maybe even bring you relief. Sometimes, what looks like dementia is actually depression in disguise. Yes, your sadness can look like memory loss. And no one talks about this enough. Doctors used to call it pseudodementia. That means false dementia. It shows up in the same way you feel foggy. You can't focus. You forget simple things. You withdraw. You lose interest in activities. You start to feel disconnected, even from yourself. And you begin to wonder, am I losing my mind? But here's the truth. When you're deeply exhausted, lonely, or emotionally numb, your brain's memory system slows down. And that's not Alzheimer's. It's your brain reacting to emotional overload. The National Institute on Aging reports that over 20% of adults over 65 have symptoms of depression, but most never get diagnosed. Why? Because many older adults don't say, I feel sad. They say, I'm tired, or my brain's not working, or I just don't care anymore. And their families might assume it's just aging. But it's not. It's treatable. And it's reversible. Depression can suppress brain chemicals like serotonin and dopamine messengers that help you think, feel, and remember. Without enough of them, your brain becomes like a house with all the lights dimmed. You don't feel like yourself, but the wiring is still there. The lights just need to be turned back on. So let me ask you, when was the last time you felt joy? Not just okay, but truly alive. Do you find it hard to enjoy things you used to love? Do you feel like you're just going through the motions? If that sounds familiar, please know this. You're not alone, and you're not broken. You are tired. You are overwhelmed, and your brain is asking for support, not a label. Please drop a comment that says, "I want clarity," not confusion. And if this resonates with you or someone you care about, share this video with them, because emotional healing is brain healing. And every step toward light starts with naming what's been hiding in the dark. Number 4, vitamin B12 deficiency, the silent brain drain. I want to talk to you about something small but powerful. It's a vitamin, but not just any vitamin, vitamin B12. Most people think of B12 as the energy vitamin, but I want you to see it for what it really is. One of your brain's most essential building blocks. Without enough B12, your brain starts to slow down, not because it's aging, but because it's starving. Your brain uses B12 to make myelin, the protective coating that wraps around your nerves. Think of it like the insulation on an electrical wire. Without that layer, signals can't travel smoothly. The result, you may feel forgetful, you may lose your balance, you may experience numbness or tingling in your hands or feet. You may even feel confused or depressed. And here's the part that worries me most. B12 deficiency can sneak up on you, especially as you get older. Why? Because as we age, our stomach produces less acid, which means we absorb less B12 from food. And if you take medications like metformin for diabetes or proton pump inhibitors for acid reflux, your B12 levels may drop even faster. According to the National Institutes of Health, about 6% of people over 60 have B12 levels low enough to cause symptoms. But up to 20% have levels that are borderline low and often ignored. And that's a mistake, because if we catch it early, we can fix it easily. A simple blood test, a daily supplement, or, in some cases, a monthly injection. That's it. No fancy scans, no brain surgery, just a quiet fix for what looks like a big problem. So let me ask you, have you checked your B12 lately if you've been feeling off, foggy, tired, tingly? Please don't ignore it. Drop a comment that says, "I'll ask my doctor about B12. That one sentence could save your clarity, your balance, even your independence. Your brain deserves full nourishment, not just to survive, but to thrive. Number 5, the forgotten gland, how your thyroid may be slowing down. Your brain, can I tell you something I wish more people knew? Sometimes the reason you feel foggy, forgetful, or mentally slow is not your brain at all. It's your thyroid. That tiny butterfly-shaped gland in your neck controls nearly every system in your body, including your brain. When your thyroid slows down, a condition called hypothyroidism, your brain follows. You may feel tired all the time. You may struggle to focus. You may feel sad for no reason. And yes, your memory might slip. But here's the thing. Many of these symptoms mimic aging, so they're ignored, brushed aside, or simply blamed on getting old. And that's the danger. According to Mayo Clinic, hypothyroidism becomes more common with age, especially in women over 60. Yet millions of cases go undiagnosed every year because the symptoms are subtle, and doctors don't always test for it. Let me say that again. Your brain fog might not be dementia. It might be a thyroid imbalance that's completely treatable. Here's what to look out for. Constant fatigue, even after a full night's sleep. Dry skin and thinning hair. Feeling cold when others are warm. Depression or low mood. Constipation. Forgetfulness or mental sluggishness. Even mild hypothyroidism can reduce your brain's processing speed. Your neurons slow down. Your reflexes lag, and your memory becomes a bit slippery. But the good news, It's easy to test. A simple blood panel for TSH and free T4 can give you answers in just a few days. If your thyroid is underactive, you can be treated with a tiny daily pill. It costs just a few cents a day, and for many of my patients, it completely lifts the fog. So let me ask you this. When was the last time you had your thyroid checked? Not guessed, not assumed, checked. If it's been over a year, or if no one's ever tested it, drop a comment that says, "Time to check my thyroid. You deserve to know. You deserve to feel like yourself again." And sometimes the answer is hiding in a place no one thinks to look. Number 6, when infection hijacks the brain, the confusion. You never expected. Have you ever felt confused out of nowhere? Like one minute you were fine and the next everything seemed a little off. If that's ever happened to you, please hear me now. It might not be your memory at all. Sometimes it's your body fighting an infection quietly, invisibly, and your brain becomes the first to sound the alarm. This happens more often than people think, especially after the age of 65. In fact, according to the Centers for Disease Control and Prevention, infections, especially urinary tract infections, are one of the top reasons older adults end up in the emergency room for sudden confusion or delirium. Here's why. When you're younger, your immune system reacts to infection with fever, pain, or swelling. But as you age, your body stops producing those dramatic signals. Instead, the infection may look like mental fog, irritability, drowsiness, or strange behavior. Your family might say, "You're acting differently," but you don't feel sick. You don't have a fever. And yet, something feels off. This is called infection-induced delirium. It's not dementia. It's not psychological. It's your brain reacting to inflammation. Inflammation from infections like urinary tract infections, pneumonia, skin infections, even mild COVID-19 or flu. This inflammation triggers brain chemicals to go out of balance. And that can cause you to feel forgetful, disoriented, or extremely tired. The danger. It often gets misdiagnosed as just aging. Or worse, it gets ignored until the infection spreads. But here's the hopeful part. When we treat the infection, the brain clears up, your clarity returns, your memory sharpens. You feel like yourself again. So let me ask you, have you recently felt off for no reason? Low energy. Mentally foggy, emotionally out of sync. Don't ignore it. Even without fever, your body may be fighting something silently. Leave a comment. I'll look deeper before I assume it's aging, because sometimes memory loss is not memory loss. It's a message from your body asking for help. You're not forgetting. You're being forgotten by the system. Let me leave you with this. If you've been feeling like something's off, like your mind is slipping, but no one's taking it seriously, I want you to hear me now. It's not just in your head. Memory loss is not always about neurons dying. Sometimes it's about messages being blocked by pills, by exhaustion, by a tired thyroid, by a hidden infection. And sometimes it's because you've been overlooked by the system, by rushed appointments, by assumption that you're just getting old. But I see you. I've sat across from thousands of people like you. And I want you to know you're not broken. You're not fading. You are still here, and your brain is still trying. You just need the right questions and the right support. So today, I invite you to take back your clarity, not all at once, just one simple step. Check your medications, ask your doctor about your B12, get that thyroid panel done. Start a nighttime routine for better sleep. Notice if your emotions are weighing you down. Because brain fog is not the end. It's the beginning of a deeper, more loving awareness of your own body. Comment below, "I'm taking back my clarity." And if this video helped you feel seen, please share it with someone you care about, because no one deserves to lose their mind quietly, while the answers are sitting just beneath the surface. And before I go next time, we're talking about something I see far too often. The 4 types of medications that secretly slow your brain, even the ones given by well-meaning doctors. You won't want to miss that, so hit subscribe, tap the bell, and let's keep walking this journey, not in fear, but in strength, together.